who is eligible for an extrapleural pneumonectomy. Sufferers of the subsequent trends frequently make grade up applicants. Early level. Localized mesothelioma, desirable coronary heart and lung characteristic. Localized malignancy. Not most cancers in the lymph nodes unfold to different tissues. Average excellent fitness, due to the fact an extrapleural pneumonectomy includes getting rid of a diseased lung. The remaining lung and the coronary heart have to be strong sufficient to endure the expanded load. Moreover, for the reason that this healing manner seeks to put off all gift cancer inside the pleural vicinity. If it has already unfolded to different areas of the frame, then the simplest palliative care can be presented. Extrapleural pneumonectomy is a technically complicated operation commonly executed at large mesothelioma cancer facilities with the aid of thoracic surgeons with great experience treating and acting surgery on mesothelioma sufferers.